Health and Family Welfare Minister Dr. Ampareen Lyngdoh has stated that she will be chairing zonal meetings in the districts of the state so as to identify the healthcare needs of all parts of the state. On Monday, she held a zonal meeting at Nongstoin where all 4 MLAs of West Khasi Hills district along with health department officials attended the meeting. She informed that an extensive meeting was held on healthcare facilities, shortage of manpower, shortage of medicines, etc.
I was very fortunate that yesterday we had the first zonal meeting of MLAs at West Khasi Hills at my chairmanship, where we were able to take on board all the 4 MLAs belonging to West Khasi Hills, and we had an extensive meeting between the MLAs, the MOs, nursing staff, supervisors, DHS and the NHM MD at Nongstoin, where a lot of the queries, a lot of the questions on efficiency of health service centers in and around the West Khasi Hills were discussed. We also took some random spot inspections. We went to a few facilities. We went to the MCH hospital, where there was this huge transfer of equipments from the MCH to Mokurwat, where these equipments were urgently required, whereas they were just sitting in a godown there in the MCH, so they were being put into better use. Then we saw the civil hospital. We also looked at the various facilities at the civil hospital. I also went to the TB testing center. I also feel that we have to look at the possibility of initiating a tuberculosis center there. We need to have a full-fledged hospital. So a lot of matters were taken up. Whatever questions that needed to be asked by the honorable MLAs was done. It was a very fruitful meeting, and I'm happy that it happened. MOs of various PHCs, CHCs were discussing the crucial matter of manpower, and we are well seized of this matter, and we are seeking for an appointment with the Honorable Chief Minister, where we will bring to his attention immediate requirement for especially specialists, super specialists, and even MBBS doctors in our systems. Some of the areas in West Khasi Hills are very far-flung, not reachable. 40%, I was told, of West Khasi Hills alone does not have motorable access. So there was this huge requirement to supply ambulances to these regions which had 4 wheels. So this is the kind of information that you receive when you go on the ground. And I'm very happy we went, because at least we'll be able to take up maybe 5 agendas for the West, which we can likely consider and overcome in the next 5 years.
What about the supply of medicines?
We discussed the supply of medicines as well, and that is another agenda where I will be taking the appointment from the Honorable Chief Minister, because we need to figure out quickly how to ensure that indented medicines from the districts are going to reach the districts ASAP. In the meanwhile, because this new organ authority that has been put in place is not fully functional yet, so immediately some amount of funds have already been released to districts to ensure that essential medicines at least are not compromised, and all facilities have. I've in fact brought a list of medicines which need immediately to be attended to. Simple materials for healthcare, from drips to syringes to gloves. There was this feeling that post-COVID again there seems to be a slum. We are going to attend to all these matters at the earliest, and going to the districts is the best way to find out what is not there and what is there. So we will be preparing a report, and we will be prioritizing all of these issues. I will have to first go to Jainti Hills, where I will meet with the MLAs of Jainti Hills. We'll have another zonal meeting there. I'll be going to West Garo Hills, where we've tried to call as many Resubelpara, others, all these MLAs together, at least to understand the minds of the MLAs at the beginning of this term. I'll be going to South Garo Hills. So I hope to engage productively like this to first understand what is this challenge that is there before us, so that we can likely make inroads in the correct direction and not just look at what NHM is telling us to do, or looking at just what a policy coming from the government is telling us to do, because so many gaps are there. I've been told that even in the utilization of MHIS, there are some very inherent issues that need to be attended. So these are the things that I learn only if I go to the districts, and I'm trying my best to do that.